Welcome everyone to the Eczema Associations of Australasia and New Zealand Inc.'s live Q&A webinar for Eczema Awareness Week 2022. My name is Michaela Pretorius and I am the Corporate Membership Officer for the EAA and the EAANZ. Thank you all so much for taking the time to join us today. We hope you learned some great tips, information and resources for how to effectively manage your eczema and learn some more about developments in the eczema space. Firstly, I'd like to begin by introducing some of our panelists for the day. So we have President of the EAA and the EANZ, Cheryl Tallant, as well as healthcare professionals and fellows of the Australian College of Dermatologists, Dr. Philip Tong and Dr. Deshawn Sebretnam. These fantastic panelists will be providing you with some great insights into eczema treatment, some great insights into this space and how you can effectively navigate this condition, both physically and mentally, with some interesting insights into the cost of living with eczema. In today's session, we will learn more about the EAA and the EANZ, as well as Dr. Tong and Dr. Deshawn's insights before we head into Q&A session. If you have any questions while the panelists are presenting, please be sure to write them on the chat panel on your control panel. We'll then be responding to these questions in our Q&A time. If we run out of time and I'm unable to answer your questions, please do send them through by email or give the EAA a call. Our details are on the website. The session will be recorded, so please have a look out on the website. We'll be sharing the audio visuals afterwards if you do need to refer back once the webinar is over. Well, let's get straight into it. We hope you learn a lot from today's section and welcome any feedback in our post-webinar survey you will receive once the session has concluded. I'll now be handing over to Cheryl Tallant, who will provide some background on the EAA and the EANZ and the importance of understanding the condition for yourself and your loved ones.
Hi everybody, my name is Cheryl Tallant. I'm President of the Eczema Association of Australasia and New Zealand, and I'm a long-time eczema sufferer, having come up with eczema when I was just a baby. My poor mum wouldn't even take me out of the house, it was so bad. I really feel as though working with the association and finding out so much about treatments and products to use has really helped me manage my eczema. And we know for a majority of the public and patients out there that this is the scenario. Of course, there are always some people that have a lot more difficulty in managing their eczema, but there are new treatments on the horizon, which is really good news. So the Eczema Association is there for everybody that wants to ring and have a chat about their eczema, find out more. We run 2 awareness campaigns every year. We have Eczema Awareness Week in May because coming into winter is a really key time for people to experience a flare. In September, we have Eczema Awareness Day, which is run on the same day as World Atopic Eczema Day. And that's the 2 times of the year in Australia where sufferers seem to experience the most flares. We're also proud members of the International Alliance of Dermatology Patient Organisations, or Global Skin, and I have the great pleasure to serve on their board of directors, and it's been a great tool and a great help to running our association in Australia. We have some wonderful corporate supporters. The Queensland Government is our platinum supporter and really helps us to do what we do. And we have a lot of pharmaceutical companies and other interested parties that just help us to keep doing what we do in supporting members of the public and our members. So we offer advice and support on an everyday basis. We don't always have the answers, but we can sort of push you in the right direction. We have all our social media accounts and we put up lots of tips and give lots of support, and people can contact us either that way through social media or via our website or by email, or just give us a call. Sometimes you just need someone to talk to when you're having a bad day, and it can be really helpful to talk to someone who's very empathetic. We have lots of helpful resources that we send out, brochures, our eczema care plan, lots of information sheets on specific topics, which is really helpful when you're trying to navigate your management plan to help just, get better outcomes for your own eczema problem. We also produce the only eczema magazine in Australia, and our members love to sort of read all the lots of informational things, members' stories, and a lot of health professionals like to put it out for their patients just so they feel a bit more connected and they're not battling on their own all the time. We also run our quarterly webinars, which we cover some great topics and have some wonderful panelists like today. So thank you to our panelists. They're always the experts, but it's really great. People who tune in, if they can't watch us live on the day, they can catch up afterwards. We have a dedicated area on our website. So you can catch up with past ones if you feel as though you need to find out a bit more information. A bit more reliable than Google sometimes. Last year was the first year we actually were able to offer a funding grant for eczema research in Australia. And it was wonderful. Our recipient of the grant, Professor Fernandez Penis, he runs a wonderful team in New South Wales, and he started a research project which we will get some outcomes about in the near future. We're also offering this grant again, and the College of Dermatology actually manages the grant on our behalf. So we know that atopic dermatitis or eczema is the most common inflammatory skin condition in adults and children in Australia and New Zealand. Approximately 1 in 3 babies develop eczema between the age of 2 to 6 months, which is, quite staggering and quite frightening for their parents. So managing eczema to prevent flares, it's a constant journey and a battle for sufferers, and it can have a major impact on your daily life. When you're an eczema sufferer, you get that sinking feeling, here we go again. So you know what signs to look out for. So it's really important to have strategies in place to manage that. The stress involved in experiencing a flare can also be one of the things that can help trigger a flare. So unfortunately, eczema in the general public is still misunderstood, and it's not quite clear to people what significance it can take in the mental and emotional toll of sufferers. It's really a difficult disease to deal with, and it's a daily battle. You don't really ever get a break. If you're caring for a child with eczema, it's just as stressful on the carer as on the child. So, of course, treatment information can be conflicting and very variable. Everyone's got, some tips to offer. Everyone's got a solution, and most eczema sufferers have tried so many things. So it's really good to be able to narrow down what actually does help you manage your eczema yourself. The emotional costs of eczema is one of those things we're just starting to get a clearer picture about. So, it doesn't only affect your skin, your physical skin, it also affects you mentally and emotionally. And we're starting to find out now more significantly how it actually affects you mentally. I mean, it's one of those things, oh, it's a skin rash, go and put some cream on it. But, while we know it won't kill you eczema, sufferers can really experience a lot of emotional impact and may want to actually kill themselves, if you like. It's such a debilitating and distressing disease. It's also common for the severity of eczema to change over time. So sometimes if you can be a mild sufferer, for no apparent reason, you can become a more severe sufferer. And this is really difficult to deal with as well. So it's important that we control the eczema as soon as it flares up. We get on top of it and we manage it as best we can. So even comparatively mild eczema can cause stress. The impact on Australians, I was recently involved in a scorecard, and managing eczema on a daily basis can be very expensive. You might have to consult different specialists, you have specific medications, and over-the-counter pharmacy products, which are all very expensive. There's currently very little financial assistance available too, which is, quite hard to deal with when you have a child with eczema and you're spending a lot of money every week. So many sufferers, when they have eczema, may need to consult all different healthcare specialists. They may be, looking at their diet. They may need to visit a dermatologist, a psychologist if they're having mental issues. And this can be costly and time consuming. So we need to offer more help for people with eczema. A lot of the time too, there's specialised treatments and products. There's all sorts of different treatments that take a lot of time and effort to attend. There's things like allergy testing, using specialised products. And we know that overall it's a very expensive disease to manage, and there's very little assistance available either through the government or through private means. Even if you have private health, you don't get much assistance with your eczema. So globally, as I said, I was involved in a scorecard globally with the global patients for eczema care, and it was astounding the results across the globe, how similar. So, you know, we found that satisfaction with eczema treatments was pretty on an even par, and there are a lot of other statistics that you might be interested in looking at. So this was interesting too, the lifespan trade-off. So adults would give up to 36% of their remaining lifespan in order not to have to deal with their eczema. That's a pretty staggering statistic. You know, there's a lot of pain and discomfort when you have eczema, and of course the mental health impacts can make you very anxious and depressed. So we need to, as I said earlier, offer more help. What's the solution? So I think collaboration across all areas of health, and this is starting to happen. One of the things we always advise patients is go and see a dermatologist, you know, have some say in your treatment or management plan. That sort of mentally empowers you to feel as though you're doing more. We also need to work with government bodies to provide more financial assistance, such as the NDIS. And this is something that the Eczema Association in Australia is looking at the moment, seeing if we can work out how we can get a bit more assistance for eczema sufferers. So one of the great things you can do if you have eczema is give us a call, send us an email, contact us on social media, and let us support you. We'll definitely point you in the right direction and hopefully just make that burden of management a little bit easier to bear. Thanks so much for listening today, and I hope you enjoy the rest of the webinar.
Thank you so much for that, Cheryl. I'd now like to introduce you to our next speaker, Dr. Phil.
Thank you, Cheryl, for a wonderful introduction to the Eczema Association of Australasia and giving me and Dr. Sebaratnam an opportunity to speak today, and also in particular to your members. And of course, the College of Dermatologists for giving us the opportunity to be part of this exciting webinar today. So just to introduce myself, I'm a practicing dermatologist here in Sydney with working in private practice as well as my public work at St Vincent's Hospital. I am involved in a number of research trials as well as overseeing trials conducted at the Skin Hospital, as well as basic research at Centenary Institute. So today I thought as a panel we would actually discuss some of the exciting insights in terms of how eczema occurs and some of the current treatments and how new treatments fit into this therapeutic landscape. I echo Cheryl's comments about the costs of living with eczema, and indeed it's a huge burden both emotionally and financially for eczema patients with this condition. And we as dermatologists need to be mindful of this in terms of tailoring a treatment plan that fits in with what certainly the level of disease and how we can assist them the best way that we can. And certainly we'll finish off by discussing tips for eczema patients and when to seek help. So I might invite Cheryl and Dr. Sebaratnam to join me in terms of discussing new insights. And I might just kick off by talking about our recent college meeting in Adelaide, whereby a number of new treatments as well as new insights into how eczema arises. Eczema was always thought to be an outside-in disease, whereby it's an issue of the barrier and issues with, for example, filagra mutation. However, as we understand eczema more, we understand very much the immunological processes involved. And with this, from this understanding, we can actually develop newer and more targeted therapies. Next slide, please. Just before I move on, Cheryl, did you want to comment, or Dr. Sebaratnam, did you want to comment about that?
I just would like to comment that I think you're right. It's great that we've got some new insights on how eczema actually affects patients. And we need to be mindful of the fact that even the cost can be quite stressful for many patients. So it would really be good to let patients know what's available. I mean, what's sometimes available at their local big hospital that they may not be aware of. There is some help available out there, it's just accessing it. But as I said earlier, we'd like to work with some more government bodies to actually put some assistance in place. For example, if you're a mum that's got 3 kids and one of your children needs wet wrapping on a daily basis, maybe a nurse to visit for 3 hours every week just to help with that process. And that really helps the stress that the mother's experiencing in caring for a child with severe eczema. So these are the sort of things we need to look towards, not only new treatments, which it's wonderful there are some new treatments available at the moment.
Cheryl, that's a great comment, because yes, as much as we as dermatologists we get excited about these novel treatments coming onto the PBS, pharmaceutical benefits scheme, either in the form of an injection or a tablet, the current treatments to date do play a role with relation to eczema management. I mean, just very much emphasize that general skincare measures is critical, and for these patients, short cool showers, lots of moisturizer, avoidance of various irritants, and we can cover those in the tips for eczema patients. But there is still a role for topical corticosteroids in the appropriate patient, and particularly if there's superinfection, the use of oral antibiotics where necessary, because we do know, for example, the microbiome does play an important role in eczema flares, for example, Staphylococcus aureus, and thereby treating this. And I know Dr. Sebaratnam will cover whether the role of bleach baths may be useful in these patients, whether or not that could be a potential solution to reduce eczema flares. On to what's on the horizon. Dr. Sebaratnam, in your capacity as consultant dermatologist at Liverpool, I know they do a lot of novel therapies in eczema. Have you had a number of patients put on some of these newer therapies?
And the results are good. I mean, as you said, you know, they're for the most severe cases, and most people with eczema can be managed very well.
And that's right. I feel that and access to these medications, for which 2 are currently come to mind, one as an injection and one's a tablet, listed on the PBS, they are a real godsend for patients. Access to them is limited to a severity score, a certain criteria that needs to be factored in order for them to access these highly specialized medicines. That being said, though, part of an opportunity to survey how other dermatologists manage eczema in their respective countries, and more and more patient-reported outcomes. So how a patient feels about their skin is increasingly becoming important in the decision-making process with relation to when a patient actually gets started on a medication. So I think for patients, it's really important to watch this space, because I think as dermatologists, we want to involve our patients more in terms of how they feel about their skin, the emotional impact, their effective quality of life. These are all important measures of deterioration, and also important measures of success when placing patients on therapies. I think that's all I wanted to discuss on what's on the horizon. There's certainly a lot more medicines that are currently being trialed and quite successfully, both here in Australia and overseas. So a number of targeted therapies that come in the form of injections, but also a number of creams as well. So it doesn't all have to be these super fancy tablets and injections. There are a number of creams that, therapeutic creams that allow us to reduce the amount of reliance on topical corticosteroids. But that being said, still a cornerstone in terms of the therapeutic armamentarium in dermatology. Cheryl, you touched on the cost of living with eczema, and you made a comment which I found very interesting. You said that you can't die from eczema. Well, you certainly can die from eczema. There has been cases where, you know, particularly young children, young infants whose eczema has not been managed well. They run into problems like failure to thrive, and Dr. Sebaratnam can talk to his experience as a pediatric dermatologist. I think this is a terrible impact on young children. And I often tell my my patients that, instead of growing and thriving and putting on weight, these children are often spending all their energy and their nutrition on repairing their skin, and thereby they're not actually meeting those certain weight and height quartiles and milestones, because they're spending all their energy actually repairing their skin. So this is not only has profound emotional, financial, but also physical impact on these patients. Deshaun, did you have any comments about that?
No, I totally agree with everything you said.
How about you, Cheryl?
Can I just add to that? Yeah, you're absolutely right. There are some cases, but they're not as predominant as other diseases. And this is the perception out there that, there are a lot of other diseases, but we get a lot more assistance with them. But a lot of them can manage with what's already available. It's only on the severe end of the scale that we see this. And we want to help everybody with eczema, not just concentrate on those that are really severe. I feel as though sometimes they get more assistance than just the ones that have quite bad flares from time to time, but aren't actually eligible for some of the newer treatments. And they seem to get overlooked quite a lot. We tend to concentrate on the ones with allergies and really severe eczema. And you're right, there's no one thing that you can't die from, but it's more unusual with eczema as compared to something like diabetes or cancer, for example. And it's good that we are finding some new treatments to really help those poor kids. What we do find is the comorbidities they often develop from having eczema quite severely, that can carry on into their life. And there's a lot of research about that now, heart problems and all sorts of things that can shorten their lifespan. So you are absolutely correct.
No, I think that lends very well to the next topic that I'd like to discuss, which is tips for eczema patients. I think both Dr. Sebaratnam and myself have spoken to various audiences, be it training dermatologists, general practitioners, pharmacists, and that education piece about managing mild to moderate eczema is just so important, because I would have to say that's the majority of most patients. Yes, there is a category of severe patients that do require our assistance as well, but for the most part, a lot of atopic eczema can be managed with topical measures, and thereby that emphasizing that educational piece, not just for patients, which is what we're here to discuss today, but also for healthcare providers and any of those people involved in eczema education. Nurses as well are very important and form part of the network of healthcare professionals involved in eczema care. So moving on to general tips for eczema patients, I do like to, my eczema consultations can be quite long, and I spend the majority of the first consultation addressing the flare. And all I want them to concentrate on is actually reducing that flare and applying the appropriate amount of moisturizer as well as topical steroids, and then treating any concomitant infection at that point in time. Once that I've actually achieved clearance or improvement from their eczema, I then talked to them about long-term management. How do they prevent eczema from coming back? And that's, for example, through the use of, we sometimes use weekend therapy for topical steroids for a period of time. We sometimes also use, various emollients, which some have various ingredients that help to repair the barriers that are affected through eczema, and of course, short cool showers and soap avoidance. And these are very much the cornerstone of managing one's skin if they are prone to eczema. Deshaun?
Yeah.
Your pearls of wisdom? No,
I mean, I'm covering a little bit in my talk, but nope, agree with everything you said. Like you said, soap-free showers, regular moisturizers.
Yeah, and I think the important tip is actually, and I think you will emphasize this in your talk, is, topical corticosteroids do play a role and have a role in eczema, so don't be afraid to use them. And as dermatologists, it's our role to teach patients how to use these effectively and safely. So Michaela, I think we'll move on to the last topic of when to seek help. So I think this is an important topic to cover. I think when there is infection involved, and I know Dr. Sebaratnam will show you some photos later in his talk, but particularly look out for signs of infection, signs of where the human body is telling you that something's wrong, having a fever, fluctuations in blood pressure, particularly for infants, not feeding well, not putting on weight. These are all signs whereby you may need to seek professional help with relation to eczema. Deshaun?
No. I totally agree. So your first port of call should be your GP, but then if in doubt, see a dermatologist.
Fantastic. Cheryl, did you have any pearls of wisdom or tips that you'd like to tell our audience?
They're great tips, and we always advise people to seek medical help. If there's any sign they think they may have an infection or their child might have an infection. But, you know, for the general population who can often just experience a mild flare at different times of the year, we do put up tips on our website. Every season we have our autumn tips, our winter tips, and it just gives you a bit of an idea of how to change your emollients, what products to use that can be really helpful, things that you can do around the home to prevent your skin drying out as much. And even little things such as in winter, we all stop drinking as much water, you know, things that really help your skin barrier just to keep as, you know, as well as it can be. And then that helps your eczema flare. So I think, you know, seek help as soon as you need it, and definitely consult your doctor or your dermatologist if, you know, you're finding it a bit too hard to manage yourself.
Perfect.
Wonderful. Thank you so much for that, Dr. Tong. Wonderful insights, and I think we've all definitely learned quite a lot from your session. If anyone has any questions for Dr. Tong, please do send it through on the control panel. We'll now be moving on to our last panelist, Dr. Deshaun.
Thank you for having me. So as mentioned, I am a dermatologist. I also have a little bit of eczema. So I know what it's like in a small way because my eczema is not too bad. My talk is going to be focusing a little bit more on management and more importantly, myth busting because there's lots of myths. So this is what eczema is. It's a dry, scaly rash. It can affect anyone from 1 day old to 101 years. It tends to be in the thin areas of the skin, so your neck, your elbow creases, the backs of your legs, but it can be anywhere as well. And so, as mentioned, eczema, about 1 in 5 Aussie kids have eczema. As time goes by, most people's immune system matures, eczema gets better, but it's still something that's very common. As I was saying, it's important to seek medical care, at least in the first step to get a diagnosis. So there's stuff that I tell people to do all the time, and then there's stuff that they should do just during flares. So the most important thing is to have realistic expectations. So a lot of people think that the eczema is going to go away, but it doesn't. The tendency towards eczema is always there. And so, as I mentioned, for a lot of people, it gets better as time goes by, but you will always have that predisposition towards eczema, and it can flare up at any time. So it's not about curing the eczema, it's about controlling. So it's just like asthma. You can't get rid of asthma, but it's about controlling it. So one of the things that I struggle with is people often get told, oh, don't use the steroids for more than 7 days. Day 8, you're still going to have eczema, so then what are you meant to do, right? So one myth to bust is that there's no time limit on steroids. I've had eczema, I've been using steroids for years. It's just one of the things. Yeah. So then in terms of your moisturizers, ideally you want something that's thick and greasy and doesn't have any fragrances or perfume or food products. So a lot of people think kind of natural things are best, but that's definitely not the case because that is a perfect recipe to cause food allergies. So we'll come to allergies in a little bit, but what happens, we think at the moment, is that you've got a defect in the barrier function of your skin, and then if you put food on top of that, the food gets introduced to your body through your skin rather than through your gut. And so that can lead to food allergies down the line. So food allergies don't really cause eczema for most people, but eczema can predispose to food allergies. And that's why it's really important to stay away from things like turmeric or other food products. But then the other thing you also want to avoid is things with unnecessary fragrances or preservatives, because there's a small chance of getting allergic to those things. So just keep it plain and simple. The bland, cheap stuff is often better than the fancy, expensive stuff. So things like QV or Vaseline or Dermies, any of the plain boring stuff is great. And so the thicker and greasier, the better. But as someone who has eczema myself, I know that the thick, greasy stuff is feral, and I am an adult and I'm a dermatologist. I still hate putting on my moisturizers, especially in winter. First thing in the morning, it's cold, you're in a rush, you have to get to work. If you don't let the moisturizer sit in, it gets all over your clothes and then you feel gross for the rest of the day. So I 100% understand the struggle. So with moisturizers, there's kind of, broadly speaking, creams and ointments. So if something is an ointment, it's oil-based. So you can leave a bottle of olive oil in your kitchen, it'll never go off. Whereas if you left a jug of water outside, eventually it'll turn green. So things that are water-based, bugs can grow in them quite easily. So then you have to add preservatives, and then you have to often add fragrance to hide the smell of the preservative. And so creams are great because they melt into the skin quite nicely, but they have lots of extra ingredients. Whereas if something's an ointment, it'll be oil-based. So you don't need as many of those additional products. And because it's an ointment, it often will get taken up by the body a little bit better because it's oil or lipid base, I shouldn't say lipid, hydrophobic base, and our skin is hydrophobic, or at least the outer cell layer is. So like attracts like. That's a very long-winded way of saying ointments look a little bit better, but then and so if you have really severe disease, I think ointments are the way to go, but maybe it's not so bad, then creams might help a little bit with actually being compliant. If it's not, struggle to put it on each day, then maybe you're going to be a little bit more diligent with putting it on and then keep things under control. So a plain greasy emollient 2 or 3 times a day. Sunlight is actually a good way of dampening down inflammation of the skin. So that's good for dampening down eczema, but then it also dampens down the function of your immune system and can predispose to things like skin cancer. So there's a bit of a delicate balance with that. So one of the questions I get a little bit is about probiotics. Click along for me. A little bit of evidence for, next slide, probiotics. So these are, it's a bit of a sciencey heavy slide, but pretty much it's looking at the benefits of probiotics, and it seems to be that there's a little bit of benefit. The tricky thing is that this is kind of a summary, lots of different individualized studies. Each of them uses slightly different probiotics, so it's very hard for me to say, go and drink Yakult, because the probiotics in Yakult might be a little bit different to the ones in the studies that you can see on screen. But I suppose from my perspective, it's something that's relatively cheap, low risk of harm, and if it helps a little bit, then fine. And so one of the other things which gained a little bit of interest was bleach baths. And so there was a few individual studies which seemed to show that they can help, but then when you pool all of the studies together, it just seems to be so helpful. So I think that some patients with bleach baths really do make a difference, and I think it's often those patients who tend to get recurrent infections, but then there's other patients where it doesn't really do that much. So with all of these things where there's kind of an evolving body of evidence and low risk of harm, I say give it a go, and if it works for you, great. So that's just stuff to do all the time, right? So plain greasy emollient, soap-free washes like Dr. Phil said, avoiding unnecessary products, a little bit of sunlight's not a bad thing either, and then there's what to do when your skin flares. The first thing is that you don't need to be scared of using corticosteroids. As long as they're used in a supervised way, the chance of running into trouble is very, very low. So it's not impossible, it's not zero, but it's very low. I think maybe a patient once a year. So we do have alternatives. We've got a class of medications called calcineurin inhibitors. There's another class called PDE4 inhibitors. And then there's different strengths in steroids as well. So I mean, chat to your doctor. There's often different things that we'll use for the face compared to the body, or around delicate skin like the eyelids. That's one area where I'm a bit careful with steroids, not because I'm worried about the skin, but I'm worried about the steroid getting absorbed into the eyeball. And then you can use steroids once a day. You don't need to use them twice a day. So they've done a few different studies and pulled all the evidence, and it seems that using the steroid more than once a day doesn't actually help with getting on top of the eczema, but it doubles or it halves how long your tubes last. That's one little cost-saving trick. And then there's no problems with using it over broken skin, and there's no problem using it over infected skin. So there was a really good study by some GPs, and they looked at the management of infected eczema, and they gave some of the patients steroids, and some of the patients steroids plus topical antibiotics, and then antibiotics in tablet form. and just using topical steroids was their effective. So those are for most of the patients with mild and moderate. Things I guess to mention, because the whole point of today's topic is the cost of eczema, is the tubes are not cheap, right? And they're only 15 grams. There are some formulations which come in bigger tubes, like 50 grams. And then if you have quite a big area of disease, you could also get more than one tube for that price. So it's not available to every single person. Obviously, we have a limited healthcare budget and we can't pay for everyone's everything. But if you have fairly widespread disease, then you might be eligible for some of the subsidized treatment that way. And then if you're kind of got really, really widespread disease, there comes a point where it's impractical to put, topical treatments all over you. So there's a treatment called phototherapy, which is administered by dermatologists. So most of the bigger hospitals will have that available and available publicly. I think a lot of private practices have it now as well. And so that's a treatment where you go into a light box, which is different to Solarium. Solariums use ultraviolet A. We use ultraviolet B in a very specific wavelength. And that can help minimize inflammation in the skin. There's traditional immunosuppressants, and then also the newer ones that Dr. Phil alluded to for people who have the most severe eczema. But I think there's lots of steps before that. I think for the vast majority of patients, if we just optimized all the simple stuff, so the good use of moisturizers. So I had a few other slides, but I guess just to echo what we were mentioning before, so eczema is not just the eczema itself. So as Dr. Phil alluded to, for little kids, it uses up a lot of their energy and their calories with your skin turning over and being red and inflamed. So those kids can not grow as well as they should. If you're not sleeping at night because you're constantly scratching, it can lead to problems. There was a study which came out in the last month or so, which is saying kids with really bad eczema sometimes have trouble at school. If you have head to toe eczema, all your blood's going to your skin and it's not pumping around your internal organs, so that can actually be very dangerous. With eczema, you have breaks in your skin, and so then bugs can also get in. So I've mentioned infections before. You can get bacterial infections. So one of the questions is, do I need to get any special tests done? So most of the time, eczema is a clinical diagnosis. If in doubt, doctors can actually do a little procedure where they remove a piece of your skin and get it analyzed under the microscope. That can add benefits in terms of diagnosis. There are other things that if you have a very funny pattern of eczema, sometimes it can be something that you're coming into contact with. So that can be a cream or an ointment or a shampoo or a makeup product you've used your whole life, and then one day your body decides to become allergic to it. You can also funnily get allergic to the sun or particular wavelengths of light. So there's tests called photo testing. One of the things that people will often present to a dermatologist with is allergy testing, which is not the tests that are correct. Eczema isn't caused by food allergies, but eczema can predispose you to food allergy. So this is not a fringe viewpoint of me. This is multiple different international bodies, and they all say very similar things, which is that you shouldn't put people on bad restricted diets because they're not helpful. The blood test and the skin prick tests aren't the correct tests to do. So they are the tests for food allergies, but not for eczema. Eczema that's caused by food allergies. But then the way to do that is, as mentioned before, with a dietitian and an immunologist, following a elimination diet. So that's about it for me. So this is my Insta. It's just Dr. Shan.
Wonderful. Thank you so much for those wonderful insights into eczema and treatments and tips, as well as the cost of living with eczema, Dr. Phil and Dr. Deshawn. We'll now jump into our Q&A session.
Thank you so much for those oversights on eczema. We have some questions. So question number one is, I've recently started a school research project looking at atopic dermatitis and different treatments that are used. Having had this condition myself from childhood, I have used steroid treatments and am aware of the possible side effects and the difficulty in trying to manage flare-ups. My project focuses on comparing calcium, I have trouble with that word, calcineurin inhibitors to traditional steroid treatments. Are you able to provide any insight on that? Thank you.
Interesting project. It's really important the body of literature has published on this topic already, because there may be some studies that have actually looked at this exact topic, but it's always well worth to have some local studies. I generally say in terms of how effective calcineurin inhibitors compared to topical steroids is that they would be more similar to the weak to moderate potency in terms of topical steroids. Deshaun, what are your take on that?
Yeah, totally agree. With steroids, there's a big spectrum, right? So we have ones that are super duper weak, over the counter, you can get them, without a script, and then there's stuff that is potent, and then you need a script for it, and then there's stuff which is super potent where you need to get a special script because it's not available in tubes. There's a very broad church when it comes to steroids. In Australia, with the calcineurin inhibitors, we've pretty much got two. So there's one which you can just get with a script, and then there's another one where you have to get it made up especially. Both of them, I would say, weak, maybe towards moderate.
Oh, great answers, thank you. And I'm so glad someone can pronounce that word. Next question is, I've been told from our doctors, allergists and dermatologists that eczema is a symptom and not a diagnosis. Is this accurate?
So eczema is a diagnosis, and it comes from inside. So it's an immunological problem that manifests in the skin, just like asthma is an immune problem that manifests in the airways, or inflammatory bowel disease or Crohn's disease. It's the same thing with gut, but eczema is definitely a diagnosis.
Yeah, you're right, Deshaun. I think eczema and dermatitis can be used synonymously, and you'll find that there's often a word in front of eczema or dermatitis. For example, there are various forms of dermatitis that could be related to atopic disease, otherwise known as atopic dermatitis, but there could be external causes for a dermatitis. For example, contact dermatitis. So that's and that contact dermatitis could be through irritation. So for example, if you wash your hands enough, everyone will get irritant contact dermatitis from just the exposure of your hands to water and hand sanitizers for that fact of late, which is an increasing problem. And then of course you can become sensitized to external allergens, and in that setting that's called allergic contact dermatitis. So that's probably where the confusion arises in terms of if eczema is a diagnosis. Indeed, it is a diagnosis. It has its own disease classification. So certainly we recognize it as a condition and disease.
Next question. My son's eczema is rarely itchy, only when the skin peeled and there's a new skin. So is it eczema?
So eczema does present with scaly skin, and as we all know, the way that skin, the building blocks of skin starts from the bottom layer and it works its way through the top. So if eczema, as a result of eczema, you have broken skin, yes, your eczema will naturally, your skin will naturally renew and you will have new skin come up underneath. But that's the nature of eczema. It results in broken skin, the immune system gets involved, and it's an ongoing cycle.
Why does eczema spread? And also, are there any studies on childhood vaccines being kickstarters to people developing eczema?
Well, we know that there are the parts of the immune system that cause eczema, and there are these resident memory T cells. So these are special immune cells that live exclusively in the skin for all of their lives, and they don't actually go back into the bloodstream. And often these immune cells are often very trigger happy and primed to react to the outside world. And that's what Dr. Sebaratnam was talking about, how in the context of food allergies and using creams that contain foods, that could inappropriately sensitize these immune cells to being exposed to things that they're not normally meant to be in contact with. And that's what causes the flare-ups of eczema. So you can even have normal skin, but that normal skin can be poised to actually react under the right circumstances.
Yeah, one of the things a pediatric consultant once told me was eczema is a bit like money. If you don't have any money, it's hard to make any money at all. Once you've got a little bit of money, it's easy to make more money. And that's a bit like eczema. So once you have a little bit of eczema, it's easy for it to spread and it's easy to get more of it. But someone who's never had eczema in their whole life, they're less likely to get eczema. So no one knows it. I mean, it was probably going to spread anyway. It's not like an infection where if you treat it aggressively, you're going to stop it from spreading. As we alluded to before, it's not a problem normally with atopic dermatitis of the skin per se, it's the immune system. The immune system goes everywhere. So there might be certain topographic things like how thick the skin is, or exposure to the outside environment. But you can't really spread eczema per se. If it was going to spread, it was going to spread. And then with the second part, anything that ramps up your immune system is going to flare up your eczema. So again, I don't think the vaccination necessarily caused the eczema, but if you do anything to ramp up the body's immune system, and that can be getting sick as well, the eczemas can flare up.
Okay, thank you so much for those answers. Quite a complex question. We have a really long question here, which has a bit of background about someone who migrated to Australia from the UK. The actual question is, do you know if the government were involved in any decisions by health funds, or how we as a community can encourage the government to reconsider a decision on the link between food consumption and the skin? And actually, Dr. Fu, you did sort of answer this earlier a little bit, but maybe just talk about this a little bit more, because this is one thing we get asked on a daily basis. Well, the second thing actually. The first thing is using topical steroids, and the second thing is diet. So maybe if we have a little bit more of a talk about diet.
So I'll start answering that question, but in the interest of time, we'll see if we can answer it as succinctly as we can. So the role of diet in eczema is certainly not a new topic. It certainly evokes a lot of investigation. Whether the government is actually specifically involved in funding education or advice or consultation with, for example, dietitians, I'm not sure, and I'm not sure if that is currently funded for eczema, but certainly that would be an interesting to pursue. But it always has to be evidence-based. With a lot of these, there are limited funds with relation to government funding, and hence looking at other healthcare providers providing advice, or whether it's dietary advice or whatever, there needs to be a body of evidence behind that. And at the moment, I don't think that the evidence is enough.
Yeah, I agree with Bill. So I mean, with all of these things in government subsidies, the government's only going to support things which have some kind of basis, or I guess are common as well. So our current understanding is that the majority of people's diet doesn't play that much of a contributory role. I guess that, as I mentioned, there are some people where it does, but I guess with anything, you have to make submissions to the government in terms of why it's worthwhile supporting it. And if there's not that many patients who are affected by a particular condition, often these things don't necessarily get the spotlight that they need. So with diabetes, for example, we know that there's a definite connection between what we eat and blood sugar control. With eczema, to be evident so far, I'm really in support of that. But the majority of people, so I think it's probably unlikely to be taken.
That is time on our Eczema Awareness Week 2022 Q&A webinar. Thank you so much for everyone who registered and joined us today. Thank you also so much to our amazing panelists, Dr. Phil and Dr. Deshawn, for offering up your time and providing some really phenomenal insights into eczema, upcoming treatments, and also the cost of living with the condition.